So next case is frozen shoulder. This is very common problem these days. Now in Sujok, we can quickly get result with the help of meridian Sujoki and correspondence system. Yes, it has many reasons, but out of 10 patients, 7-8 patients will definitely get result from correspondence and meridian Sujoki. For 1 or 2 patients, we need to find the root cause, and then after finding root cause and after making some constitutions, we can cure this chronic problem also. Okay, now first is meridian. Is first in pain management, when there is pain, first we should try meridian Sujoki. If you have level 2 understanding, then you can first try on meridians, and then you can focus correspondence. But people, those who know just correspondence, we will show all these points also. They can just do correspondence. Okay, so but I will teach all, I will focus all, and according to your knowledge, you can pick up treatment system, and all systems are equally good. But first choice I would like to give to meridian Sujoki, and I will show you what all meridians are passing in this area, because we will see 3 meridians on the yang side. One is spinal cord meridian, large intestine meridian, and small intestine meridian. In frozen shoulder, generally we, if there are 3 and we have to select one, so we generally focus on first choice in small intestine area, because maximum area, the small intestine meridian is occupying maximum area on this joint area. And then one by one we can check. And also you see all these corporal meridians on the wrist side. Which meridian is excessive, you can find by pressing these points. Here are spiritual points, So this is small intestine meridian. This is for people, those who have done level 2. Okay, and then after this I will show you correspondence simple treatment also, don't worry. So here you will check, and then check center point, check this point. So you try to check, and if you find, because how to decide? On yang side 3 meridians are passing, then how to decide which meridian we should take first? So this pressing point will show you some symptom. If you find pain in any one point, for example, if you find you find pain here, yes, when you are you just try to find in this area, yes, and if you find pain here, then it means you should first try on small intestine meridian. If you find pain here, now this is pressing pain, one is very sharp pain. So if you find pain here, then you can first check spinal cord meridian. And if you find pain in this region, shooting pain, strange pain, then you can first do bar magnet treatment on large intestine meridian. Okay, so we will focus 3 meridians. So this is large intestine meridian, you can see. This is passing shoulder area, but then it depends. Sometimes patient gets pain in this area, so you have to see. So here you can also, in this corporal meridian, the last point in the hand, you can also massage this area. Yes, you can check this area. As I told you on wrist, you have to check all these painful points, large intestine, crossing this wrist, spinal cord crossing this wrist, and small intestine crossing this wrist. And out of this, you can check which is more painful. Yes, so this is large intestine meridian. We will observe all 3. And this is small intestine meridian. You can see this small intestine meridian is occupying this area, this shoulder area, and the ending is here. Yes, last point of little finger. So this, we have 2 ends. One is here near the ear, and one is here on little finger. Yes, so we can stimulate this point because this is in our Sujok territory. You can massage this area and then check this point also. If this is painful, because when we are doing meridian Sujoki, we have to really find out one meridian. Okay. So this is how this is very famous meridian for shoulder pains. So you can also focus this small intestine meridian. Okay. And third meridian is spinal cord meridian. So this is also passing the shoulder area and then ending here. You can see in the ring finger yang side, outer side. So here sometimes, as I always tell you in class, that all these ending points you can massage. You can put one seat on this ending point also. Okay. And these are three meridians. And now after understanding that three meridians are involved, small intestine, spinal cord, large intestine, and now we will do treatment on Buell meridian. Yes. So if patient has left shoulder, you will choose this left hand, and if patient has right shoulder, you will work on right hand. So if you know bar magnet energy flows from on the yang side from arm to leg, then first step is, because this is pain management, and as I told you that these three meridians are crossing the shoulder area. So we don't know exactly which area, but then again patient can tell. Patients sometimes tell very precisely that I have pain here. That is why you should always tell patient to tell with fingertips where is the exact pain. When this person is telling with the fingertips where is the exact pain, then you can find out out of three which meridian is there. But sometimes patient says that full area is paining, and he is not giving clear idea that which meridian exactly is involved. Okay, so as a first trial, you can sedate small intestine. This is small intestine meridian. You can sedate. This is sedation. Okay, this is sedation. So because small intestine meridian is occupying maximum area in shoulder zone. So you can see if left shoulder problem, and if patient gets relief, it is very good. You can wait for few seconds, 1 minute, 2 minutes. It depends from patient to patient. Sometimes 1 second patient gets relief, sometimes 2 minutes, 5 minutes, like this. But yes, after 2-3 minutes, if you're not getting result, then you have to think about another meridian. Okay. So, but if pain aggravates, you can reverse the direction. And now you know, because algorithm, I'm not telling you now, because in this algorithm, when we are doing algorithm treatment for small intestine, meridian or shoulder pains, then we have to focus on small intestine and also on bladder meridian. We are using this, but we have to be very accurate, because we will be putting 4 magnets one by one, and we have to observe. Sometimes after 1 magnet patient is cured, sometimes after 2 magnets. We have proper system, algorithm steps. Sometimes in middle of treatment, patient says my pain is aggravated, and then we reverse the direction. Okay, so it is very good for beginners. You can just try this first meridian, small intestine meridian sedation, first choice, because pain symptom. So you do first. If it aggravates, then you will change the point. Okay. In case you don't get result, then this meridian is involved or this meridian is involved. So what you can do, you can check the painful point on the spiritual point. Check one by one, because you have to start your treatment. You have to do treatment on one meridian. If you find any sharp pain, unusual, strange pain in any of these points, you can work first on that meridian. Okay, so if you didn't get result, and after checking these 2 points, patient says, this is very painful, then you can do sedation here. Okay, like this. And in our clinical experiences, we have really seen wonderful results in many patients, sometimes in few seconds, in few minutes, but sometimes it takes time, and then we tell patient to put this magnet if this small intestine is suiting, sometimes large intestine is suiting, and then we tell patient to continue this treatment. When pain comes, you can immediately put, and when this energy is harmonized, then this pain will go. At the same time, I really love doing correspondence point of shoulder. Okay, I saw one question that if we don't have bar magnet, then how we can do this meridian sujoki? Okay, we can use palm leaf. Also, you can use these wires. Also, in case you don't have bar magnet, then you can use these wires. These are waste electrical wires. You see electrical wires. Okay, but here you will not understand North Pole and South Pole. For beginners, you can just simply cut this wire. This is electrical wire, I will tell you. You see, and waste, you can cut it like this, and then you can put this wire, because in universe everything is energy. But yes, bar magnet gives clear vision of North Pole and South Pole. So this is first choice. For frozen shoulder, I always try on small intestine meridian. You can put wire here. See, wire. And because we don't have North Pole and South Pole, you can wait for 1 minute, 2 minutes. If situation is changing, it is good. If aggravation, you can change. If aggravation, you just change, because we don't know North Pole and South Pole, you can just change. And when you're putting this wire, please pay attention that when you put on hand, you should use minimum tape, because this, when you're doing energy treatment, even this tape has energy. Okay, so you can put here like this on small intestine meridian, like this. So your meridian location should be accurate. Okay, minimum wire, minimum tape, and wait, see how patient is reacting now. Okay, sometimes very quickly, and you can after 1 minute or 2 minutes, you can tell your patient, please move your arm slowly, not like this with a jerk. Gently move and check what is the condition. If patient says, wow, this is better, I'm feeling better, then in this case, you can add one more wire on the second joint. This is also wire, different colors, but color is not important here. So this is second wire, electrical wire, small piece, and you can put. And then you can tell your patient, as soon as pain is gone, you please remove. But after a few minutes, if patient doesn't feel any pain, any relief, then you need to work on other meridian. Okay, like this, because it is very important to diagnose which meridian actually has problem. When patient is showing with the help of fingertips, this is the area of pain, then actually you will know which meridian is passing. That is why please remember all pathways, practice all pathways, then only you can transfer on hand. So this is first choice of frozen shoulder. And of course, yes, I told you, you can come, you can check this also, you can check this also. Okay. So this was the question if you don't have wire, and we use, and I will tell you palm leaf also in another case. I will tell you how to use palm leaf. Okay. Now I want to focus correspondence treatment. Now, this is left shoulder, and you know that in standard correspondence system, we have skin level, yes, skin level shoulder joint and bone level shoulder joint. So this is bone level. Okay, this is bone level, and this is skin level. So you massage this area very nicely, very nicely. Okay, you know, you never know that sometimes simple treatment gives a quick result. Sometimes, yes, people, those who don't know meridian sujoki, they can just start with this. Massage this area very nicely. So this is primary left shoulder, and in this hand, in right hand, this is secondary left shoulder. So this is left shoulder. So I'm giving you example of left shoulder, but then you can always go to right shoulder. Same treatment you can do on right hand, same magnets or wire. So this is right shoulder, bone correspondence and skin correspondence. Right shoulder, this is secondary, bone correspondence and skin. So don't neglect this. And as per reflection law, you know that this is the main point, and additionally, don't forget to press this point also. You can also pay attention to this. You can stimulate, you can press like this. Your main point is this, left shoulder and left shoulder. If right shoulder problem, then this is right shoulder, and in this hand, this is also right shoulder. So you see, right shoulder, left shoulder. So, okay, this is your example. Let's take one example, left shoulder. So you are doing treatment here, you are massaging here, left shoulder, and you are massaging here, left shoulder. Okay, and now, uh, after this, when you do this massage here, nicely, and then you can check point one by one, you should have patience actually. Now you are massaging on skin level. You are massaging on skin level. See, this is skin level. So check one by one with patience. You know, you have to do really dedicated efforts one by one. And because people are studying many system in level 1, so when you are working with main system, this is standard correspondence system, left shoulder, so you should not focus other thing. You remove everything from your imagination so that you can concentrate fully on this area, one by one, with patience, okay. And then you can check here also. And as for reflection theory, then simultaneously you can stimulate, you can do twist therapy of all lower joint. These are supportive treatment. This is main, and then all these lower joint stimulation. If you are manual massage, sometimes people are so expert in manual massage without putting magnets, colors. Their massage techniques are so good, they treat with just massage because you are opening some blockage, and they know what is next step, next massage, this, and like this. Okay, so this is according to reflection theory. Then next is, if you find painful point here, then naturally you know that you can put seeds here exactly if you point, and don't, your tape should not be very loose, and also it should not be very tight. Okay, and sometimes twist therapy is also giving good result. Skin twist, this is skin twist like this. Okay, and now come to insect system. Now you have to be expert in finding painful point in main system, in insect system, in mini system. So now in insect system, we are keeping our direction like this. So this is your left shoulder here, right shoulder. So in each finger, you will check all shoulder points, all shoulder points. Okay. Oh, if patient says, this is very painful, I have strange pain here, then you can put one seed here. And tell patient to press from time to time, and before leaving patient hands, you will also press and then advise patient to press from time to time. Okay, so then you can check. You may find 1 point or you can find 2 point also. Then you can, put second seed also, no problem. So first was, this is this main joint, this is main stimulation, and these are additional. Okay, these are additional according to reflection, like this. And if patient says this area is giving a little pain, then also you can put some seed here. Okay, now according to this corporal meridian, this is large intestine meridian, and I told you the last point. Here you can massage and check. Okay, corporal meridian, and this is the point, and then one seed, one small fenugreek seed will do. See here. Finish. Okay, and then you see this is large intestine meridian, and one this point you can just massage. This is one point of corporal additional point. Actually, this is also painkiller point. In all diseases, we have habit to massage this point. Okay, so in this web area, you can see these two bones, one bone and this bone, and where this bone is meeting, in this web, you will massage this area nicely in shoulder pain, and then you can fix one dry piece. You see one dry piece in this area, in this web. Okay. So I'm doing all variety of steps, but sometimes in one point pain goes, sometimes just with one bar magnet pain goes. Yes, but you should know all steps. In case pain is not going, then you should know all steps. Maybe this point will help, or maybe this point will help. Okay, and then next is, if person has problem in arm, in elbow pain, in arm, wrist pain, elbow, shoulder, any arm problem, you should definitely search painful point in cervical area. So this is cervical is part of spine. Okay, so you will check one by one. Yes, so now I'm just doing demonstration on my hand, and you will do it with patience, one by one. Check. You will find painful point here, and if you find painful point here, you will put one seed here. In case maximum points are painful here, then with the help of this paper tape, you can make chain of black pepper or green beans, green lentils, white dot will touch the skin, you can put here. So for all arm diseases, you should focus this cervical area. This is part of spine. Okay, so all these are main points, surrounding points, and also you treat it on spine. Okay. Like this. And as I told you that you will check here on this wrist according to corporal meridian. These are spiritual points. So you will check here one by one, which is painful. 1, 2, 3, check. And wherever you find painful point, there you can fix this seat with the help of paper tape. If you find pain here, you will fix here. And if you find in this area, you have to check here. You will fix it here. And if you find pain here, then you will fix it here. Okay. As we always say that we are doing Sujok therapy, foot is jok. So whatever treatment you have done on hand is soup, and now you can just focus one simple small treatment on foot. It is very good. This is very good harmony, Sujok treatment, hand and foot treatment. So you know that this is in sex system, this is cervical area, and here you can find out, shoulder point, right side or left side, and this area you can massage, according. Here also in foot we have bone correspondence and skin correspondence. Actually you can check which is more painful, and you can put seat here. Okay, you can put seat here like this, massage nicely. Pay attention to foot point also. And then last is, don't forget to treat brain point. So either you can check painful point on animal head, or you can check painful point on this human head, this point. So all treatment, in all treatment, we will definitely put point on brain and also point spinal cord area. Sometimes I want to focus, sometimes mini systems gives great result. Only mini system. Actually, you will get experience. This is, I'm telling you everything. But on patient hand, we are not doing everything. Only thing is that, yes, if we don't get result, then we think next, what I should do next, what I should do next. But then in mini system also, don't forget, this is cervical area. You know this? Yes, cervical area, and you will check one by one. And also your shoulder point in mini system also, don't forget this. As I told you, I took division, and then I told you arms and legs area. You can find painful point here. You see, you have to go on micro system. If you don't get result, then you have to do research, more research, more research. In mini system also, we have shoulder, we have elbow and wrist like this, and then we have leg, we have arms in mini system. So you can always check. In case you are not very you're not very used to mini system, then do one thing. Below the nail, just try to find painful point one by one. And if you find very strange and painful point, you can put mark, and then you can put seed. So this is how you check. If a left side problem, then you can check all these left mini system fingers. Okay, and then you can put point. So I gave you various points, but you will see that sometimes just with meridian Sujoki, pain goes away. And now you can tell your patient to continue this treatment. If pain comes like this correspondence treatment, he can do it every day. But meridian Sujoki in some patients, it is very, very good, giving fast result. Then you can tell your patient that if pain comes again, and you can show him, mark, he can put this bar magnet again. Or even if he is putting this wire, you can just put mark on one end. On one end, you can put mark like this, so that patient knows that this application was suiting him. So next time when this patient is putting, he will put the same thing, same way. Okay, and then you have to guide, you have to tell your patient that as soon as pain is gone, you should immediately remove this. Okay, and if it is aggravated, you can change the direction. Okay, thank you.
Smile.